Trauma can have a significant impact on the brain and can alter its structure, function, and chemical balance. Here are some ways trauma can affect the brain. The amygdala. The amygdala is the part of the brain responsible for processing emotions. Trauma can cause the amygdala to become hyperactive, leading to an exaggerated fear response and an increased sense of danger. The hippocampus. The hippocampus is the part of the brain responsible for memory formation and recall. Trauma can damage the hippocampus, leading to memory impairments and difficulties in recalling details of the traumatic event. The prefrontal cortex. The prefrontal cortex is the part of the brain responsible for decision-making, problem-solving, and impulse control. Trauma can damage the prefrontal cortex, leading to difficulties in regulating emotions, making decisions, and controlling behavior. The stress response. Trauma can cause a dysregulation of the stress response system, resulting in an overactive sympathetic nervous system and an underactive parasympathetic nervous system. This can lead to symptoms such as hyperarousal, anxiety, and insomnia. The neurotransmitters. Trauma can affect the balance of neurotransmitters in the brain, leading to imbalances of chemicals such as serotonin, dopamine, and norepinephrine. This can contribute to the development of mood disorders such as depression and anxiety. Brain development. Trauma that occurs in childhood can affect the development of the brain, leading to long-lasting effects on cognition, emotion regulation, and social functioning. When trauma affects the brain, it can have a significant impact on an individual's mental, emotional, and physical health. Trauma can have a lasting and serious effect on the brain. PTSD, or post-traumatic stress disorder, is a condition that can develop after someone experiences a traumatic event. Symptoms of PTSD can include flashbacks, nightmares, anxiety, depression, and difficulty sleeping. People with PTSD may also feel detached from others, experience problems with memory and concentration, and be easily startled. While there is no one-size-fits-all approach to treating trauma, here are some steps that can help when trauma affects the brain. 1. Seek professional help. It's important to seek professional help from a therapist, counselor, or mental health provider who specializes in trauma recovery. A professional can help individuals understand and address the impact of trauma on the brain and overall health. 2. Build a support system. Surround yourself with supportive friends and family members who can provide emotional support and encouragement. 3. Practice self-care. Take care of your physical, emotional, and spiritual needs by engaging in activities such as exercise, healthy eating, and meditation. 4. Learn about trauma. Educate yourself about trauma and its effects, so you can better understand what you're going through and how to manage it. 5. Practice grounding techniques. Grounding techniques can help individuals feel more present and less overwhelmed by their emotions. Examples of grounding techniques include deep breathing, mindfulness, and physical exercise. 6. Develop coping skills. Develop coping skills that can help you manage stress and anxiety, such as deep breathing, mindfulness, or journaling. 7. Identify triggers. Identify situations, places, or people that trigger your traumatic memories and work on developing coping strategies to manage them. 8. Challenge negative thoughts. Identify negative thoughts and beliefs that may be contributing to your trauma symptoms and work to challenge and reframe them. 9. Practice self-compassion. Be kind and compassionate to yourself. Recognize that healing from trauma takes time and effort. 10. Explore treatment options. There are many different treatment options for trauma recovery. One of the most effective treatments for trauma is cognitive behavioral therapy, CBT. CBT can help people to identify and challenge negative thoughts and beliefs that may be contributing to their distress. It can also help them to develop healthy coping mechanisms and learn new skills for managing their emotions. Other helpful treatments for trauma include eye movement desensitization and reprocessing, EMDR, and exposure therapy. EMDR involves using bilateral stimulation, eye movements, sounds, or touches, to help the brain process traumatic memories. Exposure therapy involves gradually confronting situations or objects that remind the person of their trauma in a safe and controlled environment. This can help to reduce fear and anxiety around these triggers. Discussing different options with a mental health professional can help determine the best approach for individual needs. In conclusion, trauma can have a significant impact on the brain and its overall functioning. It is important to recognize the signs of trauma, so that it can be properly addressed and treated before any long-term damage is done. Additionally, understanding how trauma affects the brain will help us better understand why certain behaviors arise in response to traumatic experiences. With this knowledge, we can work towards finding more effective treatments and therapies for individuals suffering from post-traumatic stress disorder or other mental health issues brought on by traumatic events.